Is resistance training safe? Have you ever wondered if resistance training is a safe option for managing hypertension? Today, we will explore this important question together. Resistance training can be a beneficial part of a healthy lifestyle, especially for those dealing with high blood pressure. Research indicates that resistance training is generally safe for individuals with hypertension, particularly when it is performed at low to moderate intensity. This means you can engage in resistance exercises without putting your health at risk, as long as you follow proper techniques. Studies show that resistance training can help lower both systolic and diastolic blood pressure. For instance, isometric exercises, like squeezing a hand grip device, have been shown to reduce systolic blood pressure by about 10 to 13 millimeters of mercury and diastolic pressure by approximately 6 to 8 millimeters of mercury over several weeks. When it comes to safety, resistance training does not increase the risk of serious cardiovascular events for those with controlled hypertension. In fact, some studies report fewer cardiovascular complications during resistance training compared to aerobic exercises. This is reassuring for those looking to incorporate resistance training into their routines. To safely include resistance training in your lifestyle changes for hypertension management, aim for low to moderate intensity. This typically means lifting around 30 to 40% of your 1 repetition maximum, which is the maximum weight you can lift once. It is also recommended to engage in resistance training 2 to 3 times a week. Each session should last several weeks to see the benefits in blood pressure. Proper breathing techniques are essential to avoid spikes in blood pressure during exertion. Tailoring your resistance training to your individual health status is important, especially if your hypertension is uncontrolled or if you have other cardiovascular risks. Always consult with a healthcare provider before starting a new exercise program to ensure it aligns with your specific health needs. In summary, resistance training is a safe and effective strategy for managing hypertension when done correctly. It can help lower blood pressure and improve overall cardiovascular health without increasing the risk of adverse events for those with controlled hypertension. Embracing resistance training as part of your lifestyle changes can be a positive step toward better health.